from anterior to the posterior now. So we cover this muscle, this muscle, this
Yes.
muscle, this muscle.
Yes.
This is a one muscle, okay? If you
Like
remove this,
underneath,
you will see
right?
the broad.
Like this little piece and,
And
then
we were
that
calling
thinner
that the
piece.
thyrohyoid.
Thyrohyoid.
Okay.
Now when you move posteriorly, you will see 1, 2, 3.
Scalenes.
That is a scalenus muscle.
Okay.
Okay.
This is anterior scalene.
So we do need to differentiate
Middle,
between the two.
scalene.
Okay. That was one of my questions for today.
Scalene.
Yeah.
So these are the scalenes.
Okay.
Okay.
That was
It's
one of
just
my
based
questions.
on the location. That's it.
Good.
Now this muscle coming from the superior angle of the scapula and moving all the way to the base of the skull.
Levator.
So it's surround the margin of foramen magnum.
Okay.
So it contract, it elevate
The
or
scapula.
raise the scapula. That's why we call it levator.
Scapula.
But if levator elevate the scapula, we call it levator scapulae.
Scapulae.
Oh,
Scapulae. Levator scapulae.
Elevate scapula.
Yeah.
I wish that I spoke all these languages because it
Now
would make it so
you
easy.
remove the trapezius,
Yes.
then you will see this muscle. This is the splenius capitis.
Because of the cap. Because it's to the
Actually,
It's like
this
the cap
one
of the
you will
skull.
want to, if you want to go more detail, you are going to subdivide it.
Okay.
This portion here is close to the skull.
Yes.
You will call it a splenius capitis.
Okay.
And this portion is associated close to the cervical
Cervix.
area. So will be the splenius cervicis. Splenius capitis, splenius cervicis, but I'm not going to ask you to distinguish.
Still interesting.
Here, deeper to this, if you remove this, then you will see this muscle, it kind of have a fall, two portion. That's why we call it a semi.
Okay.
So it will be the
Semispinalis.
semispinalis.
Semi-spinalis.
The one that close to the base of the skull, semispinalis capitis. The one that spans and the cervical region, that is a
Semispinalis.
semispinalis cervicis. And there is the fibers going down to the thoracic areas. What do you call it? Semispinalis thoracis.
Right.
Okay? This is on this model. If you move on the posterior aspect down to the upper thorax, then you will see these two muscles. This muscle here is take a form as the rectangular or parallelogram. And we call it a rhomboideus minor, rhomboideus major.
Just based on size. Minor, major.
Yeah.
Okay.
What nerves innervate these? Thoracodorsal.
Oi.
Thoracodorsal.
That's crazy.
Now when you move lateral to that, you will hit the scapula again.
Okay.
It is the spine of the scapula. This muscle is located above the spine of the
Right.
scapula. We start with supra, and this is
Suprascapularis.
infra.
Infra.
So name the fossa about the spine of scapula.
Suprascapulus fossa. Suprascapular fossa. No?
Never
Supraspinous.
suprascapular. Yeah.
Supraspinous.
Supraspinous, not suprascapular.
Supraspinous,
Yeah,
right? 'cause
I
it's
heard
above the
someone.
spine. That's a
I
good
heard
one. Good
someone
question.
that comes to the suprascapular. No,
Supra-
we
It's a
refer to the spine.
Okay.
Supraspinous
Spinous.
fossa. Fossa.
Okay.
Now, when it comes to the muscle,
So you said,
supraspinatus.
so you'll say what's the fossa as opposed to what's the muscle.
Yeah.
Okay.
So the difference
Okay.
is only one letter M.
yeah.
Wow.
Okay.
One is
Yeah,
a
we got
supraspinous fossa. The muscle is supraspinatus
Spinatus.
muscle. Here is the
Infraspinatus.
infraspinatus
Muscle.
muscle.
Okay.
What nerves innervate these muscles?
I wish it was like the spinatus.
Suprascapular muscle.
Suprascapular
That's when
nerve.
you're saying
Supra-
suprascapular.
Scapular muscle. Until nerve, it refers to the scapula. Muscle refers to the
Spine.
location referring to the spine of the scapula.
Okay. Interesting.
Now when it comes to the anterior on this model, if you take a look at these muscle here, there is the muscle that run like a sheath or a drape of a muscle, starting from the inferior border of the mandible and go down all the way to the upper thorax. And this is very, very thin muscle, and this is known as platysma.
Platysma.
Okay, the platysma. What nerve innervates the platysma? Facial nerve.
Oh,
Okay.
Facial nerve innervates the platysma. And if you take a look,